Welcome to ExpertVue Episode 2, sponsored by Vuetech Health Innovations, a series where we will speak with experts in the fields of biotechnology, healthcare, and aging. I'm your host, Amal Baloo. Today we have Dr. Brittany Behar, a plastic and maxillofacial surgeon at the University of Virginia, who has over a decade of experience managing and treating pressure ulcers. In this episode, Dr. Behar teaches us how pressure ulcers form, explains some of their consequences, and shares how she believes Vuetech's emergency video alert system, EVA, may help prevent them.
I was fortunate enough to be contacted by our founders, and they were looking for more information about how their product could help those with pressure sores, as they know that's an issue for many patients, both those with paralysis and those without, who are facing prolonged hospitalizations. And so we had a really nice conversation where we got to discuss how can we really help this patient group that's basically ubiquitous to every hospital in the country. So pressure ulcer happens when a patient is sitting on or lying on a certain area of their body for a prolonged amount of time. But when you're incapacitated or paralyzed and don't have those pain feedback signals, then you continue to sit on that area or to lie on that area, and there's a decreased blood flow to that area. Tissues can really only survive for up to 2 hours without good blood flow before they actually start to die. A lot of times you'll see a small wound on the outside, whether it's on the scalp or on the shoulder, on the butt, on the leg, and it's actually a deeper problem. We often call it an iceberg. So there's actually a significant amount of tissue under that small wound that's unfortunately dead. And when we take these patients to the operating room to debride all the dead tissue, they're left with very large wounds a lot of times, which sometimes also have exposed bone, and your body just doesn't do well healing those over. And so a lot of times these patients will need prolonged dressing changes, a lot of change in their sitting regimens or offloading regimens, nutrition help to help them heal the wounds, and then eventually sometimes they need reconstructive surgery to actually move tissue over to close those wounds. Ultimately, if there's a way that we could prevent them from happening in the first place, that's always ideal. I think the most important thing about Vuetech is that it focuses on prevention as opposed to treatment. The way that our hospital system works is these are seen as quote-unquote never events. And because they are so devastating, we as a nation have decided that this is something we really need to try to prevent. And if we can add this to our armamentarium as a signal that patients are an impending problem with pressure, that would be really great, as opposed to having to deal with them in a reactive way. Ultimately, these patients really have to go through a lot to get to me, and they have to deal with a lot even after they see me. And so if I can avoid that for them, that would be the ultimate goal.
Thank you, Dr. Behar, for your expert insights, and thank you to our viewers for watching another episode of ExpertVue. Be sure to follow Vuetech Health Innovations on Facebook, Instagram, and Twitter for more updates on EVA and for our next ExpertVue episode. Thank you.